Welcome to the Strong Women Real Fitness Group, and here to talk to us today is Dr. Kinney. She is a naturopathic doctor with a whole lot of passion, and I'm so excited to have her here today sharing with us. She specializes in women wanting to lose weight, adrenal fatigue, basically just helping us survive. So I know we've talked a lot about diet and stress management and things like that already, so we were going to just go ahead and dive straight into inflammation. So, Dr. Kinney, take it away. How do you feel about that?
So I think a lot of disease today, its root cause is inflammation. I mean, when you look at any disease and you get down to the cellular part of it, it's really what's going on, what piece of the body is inflamed, and lowering inflammation really helps us get back on a path towards healing. So there are lots of different ways to do that. There are lots of different parts of the body that can be inflamed, and a lot of what I look at is helping to take away inflammation in the GI tract, which I know we're going to talk about more later. But inflammation there can cause problems with absorbing nutrients. It can cause allergies. It can affect the immune system. It can affect your gut flora. So really, addressing inflammation at that level of the GI tract is hugely important for all kinds of issues.
Okay, cool. So let's take a step back and tell me, how do you even get the inflammation in your GI tract? So let's just start from the beginning and work our way through that.
Yeah, so I talk to, I usually when patients come in to see me, I will draw this little picture of leaky gut, which we kind of heard of what leaky gut is. And that's basically, inflammation at the level of your small intestines, where your body's trying to absorb nutrients. So there are a lot of different causes. The number one, and probably the most important thing that I talk to women or all patients about, is dehydration. So when your cells get dehydrated, it's going to trigger inflammation. So that, and the number two is probably stress of any kind. So stress of having a baby, childbirth, that stress, or any kind of trauma that the body goes through can trigger that inflammation to kind of get activated. Number three is chronic or overuse of antibiotics, or even just one, you get a really bad sinus infection, you take a Z-Pak, that one, antibiotic round can trigger some inflammation in the GI tract. So those are the three big things that I like to address: the dehydration, stress, and antibiotics. Now, there are some other things. If you have allergies to certain foods and you're eating them all the time, those foods can sometimes trigger inflammation. But I find usually the underlying root cause are going to be those three things that I just mentioned: dehydration, stress.
Okay, so let's break down a little more of those. Most of the women in this group are moms, and a lot of them have been breastfeeding, have multiple kids, so they've been breastfeeding for a long time. I know I personally found the water intake that you have to consume to keep up with breastfeeding pretty much puts me in a chronic state of dehydration unless I just feel like I'm gulping it. So.
Yeah, so, and I find this common with a lot of women, even women who aren't nursing all the time, but that nursing makes it that much harder. Keeping hydrated, water is just one piece. You also need to make sure your salt intake is adequate. Your different electrolyte intakes are adequate. So I talk to a lot of people about adding in some electrolyte options. Sometimes coconut water can be a really good thing to help rehydrate the system.
Plus, that helps with not being constipated. I love coconut water for that.
Coconut water is awesome. I recently, personally, I'm a mom. I have two young kids, so I've been through this. I personally know this one really well. During pregnancy, I had such a hard time staying hydrated, and during nursing, I started drinking these electrolyte replacement tabs. They're called Nuun, N-U-U-N.
Okay.
Drop them in water, and they worked really well for me. Sometimes I have some patients that drink those emergencies, the little packets that you add in, so those can help. Or just drinking, a little bit of juice mixed with water, something that's going to give you back some of those electrolytes can really help your body retain the water that you're drinking. And that can help keep those cells hydrated so we don't have that dehydrated, leaky gut layer.
So I was just laughing because I was thinking about eating potato chips earlier. And my thought process is potassium and sodium. These are so good.
Yeah. Well, and the other thing, while we're talking about this, a lot of patients that are struggling with adrenal fatigue. So, if you're having multiple kids and you're nursing, your adrenals are stressed. Your body, children are wonderful, but
they're stressful.
they're really stressful. And pregnancy, nursing, it's all stressful on your body. It's, you're leaching nutrients, so your adrenals get really tapped out, and the adrenals have to do with how water is balanced in the body. So and people that have adrenal fatigue, they need extra salt. So I often tell my patients, I need you to salt everything, eat salt, take salt tablets, and that will help you retain the water. And it's also really nourishing for your adrenal glands.
That is such a great point, because we think of healthy, we think of taking out the salt, not adding it in. That's such a great point. Say it one more time, just so it gets through to everybody.
So, if you're a mom and you are, if you're having, even if you've just had one kid, it's stressful on your body. And when you undergo a lot of stress, your adrenals get tapped out, and your adrenal glands, they need salt to function. So add some salt. Don't feel guilty about having
enjoy some salt. I love it. There's so many, it's just so hard being a mom and not feeling guilty because we want to be the best that we can be.
Oh,
and so finding healthy ways to handle that, and just taking everything that we can take off it's just a good thing. Thanks. That's really awesome. Such a great tip.
Yeah. So staying hydrated. And so what was the next thing we were going to talk about?
Yes, you were number 2. So we're going to get into a little bit of mindset stuff and trauma, but just talk to me a little bit about stress in general for this. And I mean, childbirth is a very, very stressful situation, even if it goes perfectly.
Oh yeah. I just had a patient in here earlier today, and she was coming in, wanting to lose an extra 15 pounds that she's been struggling with since her son was born 4 years ago. And we were talking about her birth, and, she had a healthy son. He had some breathing issues. He had to go to the NICU for a little while. And she was like, yeah, it was stressful, but that's not a factor. And I had to stop her and say, no, that really is, that's a really important thing. We need to address this issue. Birth, as you said, whether it's a totally normal childbirth or it's, the horrible, you go through 20 hours of labor and end up with a C-section, it's stressful on your body. I mean, it always, it ends up being the most wonderful thing because you get a baby out of it, but it's traumatic for your body. So it kind of sets you up for this adrenal fatigue. And then the first 6 months of a baby's life, you're being woken up every 2 hours. You're not getting normal sleep.
You're funny. The first 2 months, I still, my youngest is 11 months, and I don't always still get to sleep through the night.
Yeah, I have 6 months to do that. That's an optimistic look on it. Sometimes it's the first 3 years. I mean, kids. So you're getting woken up. You're in this perpetual fight or flight state because at any given moment, and if you've multiple kids, any given moment, any one of your children could wake up and they need your attention. So your body can't relax. So when you're in that fight or flight, all your blood flow goes to your legs, to your arms, to your, so that you can get ready to run or fight. And you're getting ready to take care of a baby, but your brain doesn't know any different. It's just up and it's on edge. And when you're on edge like that, that means all of the blood flow that's normally in your digestive tract, it's not there. So we're not getting good blood flow. We're not getting good oxygen. So this is kind of why chronic stress leads to inflammation, specifically in the GI tract, is because we're not getting blood flow, we're not getting nutrients, we're not getting oxygen, because all the blood flow and the nutrients, the oxygen are all in your limbs so that you can run, fight, and go take care of your child. So
that's one thing that we talk about basically every single day in the group is we need deep breathing to fix our pelvic floors, to fix our gases, to fix our bodies. And that stimulates the vagus nerve, which stimulates the parasympathetic nervous system. So I am constantly.
And that is, whether we're talking gut health, inflammation, Lyme disease, chronic fatigue, that deep breathing that's activating the parasympathetic nervous system is the most important thing you can do for your health. So I have so many patients where, the first thing on their treatment plan is, practice belly breathing 5 times a day. And then I've got the rest of all the other things. And I'll come back and I'll be like, okay, so let's go over, tell me which ones you've been doing. And they're like, oh, I didn't do the belly breathing. I'm like, no.
That's the one you need the most.
This is the most important part. And it seems silly, right? It's like, oh, it's just breathing. How can that be really that important? Well,
it helps tremendously.
You don't breathe, you're not living. So.
And you may have some very specific tips, but one thing that helped me the second time around, I realized that I didn't sleep well the first time around because I was waiting on her to wake up. So the second time around, I actually slept in earplugs because it was my way to switch off. And it was my husband's job to listen for the child.
Yep.
And I got to sleep, and then he would just swap me and I would get up. So he didn't have to get up, but I got to sleep between sessions. And that was priceless for me, because then at least I got some good sleep and I wasn't listening out.
Yeah, and that's a really good tip. I recommend that to people. Earplugs saved my life because, and moms, you're kind of wired to be in that. Oh, I better be ready to go.
Oh,
So
he didn't worry about it. It didn't stress him out. It didn't affect his sleep to listen out for a child.
They wake up, they go right back to sleep. But women, and if you put your baby to bed and you're like, oh, they're kind of cutting a tooth, I'm kind of expecting, you're not going to sleep as well because you're anticipating that wake up. So yeah, earplugs are great.
Earplugs are good.
We were back on.
Okay. So if you do take an antibiotic,
yes.
Unless, did you have anything else on the stress thing? Okay. That means, yeah, we have a lot more, but if you do take an antibiotic, what steps do you recommend for regaining your body back from that one?
Yeah. So, and there are always going to be times when you need to take an antibiotic. If one of your kids has strep goes through the house, yeah, it happens. So, and the most important thing is that you replace those good guy bacteria right away. Don't do it while you're taking the antibiotic. You'll just waste your money. But as soon as that last dose is over, you want to take pretty high doses of probiotics for the next month or so, I would say.
And do you have a brand that you recommend, or?
I have no affiliation with them, just said I really like Claire Labs. They make one they call it ABX support. So it's specific for after antibiotic therapy. I'm pretty sure you can get that on Amazon. But they're a really nice brand. It honestly doesn't matter too much. You just want to replace like the big guys, the lactobacillus, the bifidobacter. And you also eat as many fermented foods as you can. So drink a kombucha, go have some sauerkraut, have some kimchi. Try to just get as many of the different bugs back into your body so that your body can just kind of reestablish that good flora.
So drinking a kombucha is one of those things that just makes me feel special because they're so expensive. So when I go to Whole Foods or somewhere, and I'm like, I am going to get myself a special drink. We have those things where we really need to. Self-care is not selfish.
Oh yeah, no, it is not. Self-care is, and this has been something I've had to really learn as a mom. This is the hardest thing, is finding the balance between being a mom, for those women that you work with that also work and have to try to find time to take care of yourself. But you will be a better mom and you will be healthier if you find time to take care of yourself, and if part of that is having your kombucha or your coffee or whatever your special ritual thing is. But I so oftentimes will say, or I'll get patients who will say, no, I don't have time to get that massage, or no, I can't make it to yoga because, I've got to be home for the kids, or, you have to schedule those things. You have to make sure, and even if it's only 20 minutes away, you have some amount of time where you are focused just on you. And
I'm asking people to exercise. It's hard. And then I have those women that just take it and run with it, and they do everything and they set aside the time. And then I have the ones where I hear nothing but I don't have time. And I'm like, well, your life isn't that much different. Everybody's life is hard in some way. So do you have any strategies to offer other than just prioritizing yourself? Do you have any other tips or strategies?
I mean, I think it depends on, I do have several different tips and strategies. It's someone who's a stay-at-home mom. It's a little different than someone who's full-time working versus someone who's, and sometimes money comes into play here, I don't want to pay the babysitter to go and, do this. So it's kind of figuring out, for each situation, what's the best. If we're talking about exercise stuff, if you're a stay-at-home mom, find a way to exercise while your kids are there.
Either nap time, or a lot of them will actually join a gym with childcare.
Yeah, which is
just to have that free babysitter.
Yeah, and sometimes that's good for the kids. They get out, they socialize, that's always a good option. And and if you've got a good partner, this is where you need to say, hey, listen, like, this is where I need your support. I need you to watch the kids for me, so I can
in the morning or the evening or a lunchtime. Yes, to say I need 30 minutes.
Patients, frame it to your husband in a way that, if I'm happier, you're going to be happier. You might get to have sex more, or you might get more cuddle time, or, because let's face it, if you're a mom and you don't get any you time, the last thing you want to be doing is, getting
Pouring
intimate.
into somebody else. Oh yeah.
Yeah. But all, now that we're talking about that, but sex is really important. Sex is a great thing for, getting you into that parasympathetic de-stressor thing. So, doing
But
whatever.
it's that feedback loop though, because if you're not deep breathing, if you're not relaxing, if you're not pouring into yourself, then you're going to be in that fight or flight mode, which shuts down your sex drive, shuts down your ability to have a bowel movement, makes you, it just, yeah, then you get in that bad feedback cycle.
And then you're cranky and not feeling good. Yeah. So starting with the breathing, and the thing about breathing, you don't have to go anywhere. You don't have to get someone to watch your kids. You can do breathing in the car while you're sitting at a stoplight. You can put your hands on, you can do belly breathing there. So, I always get into it with my patients. I'm like, can't tell me that you don't have time to do 30 seconds.
You have time to breathe. You're breathing all day long. Just make it count when you breathe. Okay, so this is really awesome stuff. Anything before we move on? I really wanted for you to talk to me a little bit about homeopathy and just treatments there that you recommend. We kind of touched on that a little bit on the phone.
So I don't know, if everyone's familiar with homeopathy. I'll just give you my quick little spiel on I use my kombucha bottle to explain homeopathy. So imagine this is an upright punching bag, one that is weighted at the bottom. If I punch it this way, it's going to go like this. If I then leave it alone, it will then do this and will eventually come back into balance, right? Because it's weighted. So sometimes we get out of balance, right? So our body is kind of like this punching bag. When it's upright, we're symptom free. We're healthy. We're feeling good. You're the most you can be. Let's say life throws you a punch, like you get the flu. You're over here. You now maybe have a fever. You might throw up. You might have diarrhea. But all of these symptoms are indicative of your body trying to kill the flu virus to come back into balance, right? So sometimes, and your body will get over the flu, right? We get like this, we will get better and you heal. Sometimes your body gets punched like in a chronic way. Something's punching it over and over again. And your body's having a hard time healing, you've got inflammation, whatever your symptoms are. You go to see your Western doc, they will prescribe you a drug that will punch you this way. It'll take away your symptom, but then often it will cause a side effect.
Yes.
You go back to them and you say, yeah, oftentimes I see this with, painful periods or, really bad migraine headaches or something. They're like, oh, let's put you on the birth control pill. All right, well, the birth control pill punches you this way. Maybe now your periods are normal, or you maybe don't get periods anymore, depending on what happens. But now you have some other symptom. Maybe you've gained 10 pounds and you can't get rid of it. Well, then you go back to the doctor and they're like, oh, well, we got another drug. It'll punch you back over this way. Now you're over here, you've got a new symptom. So you kind of go back and forth like this. You're always going to have a side effect from whatever drug. What a homeopathic does is you're here, it will punch you a tiny bit this way in the same direction that you're already going to give you momentum so that your body can then overcome whatever that is on its own.
Yes.
Does that make sense?
Yes.
So in using homeopathics for healing inflammation, like muscle inflammation or soreness, there's a really great remedy called arnica. So in arnica, it's made from a flower that sounds weird, but it's actually a poisonous flower. And if you were to eat that flower, it causes bruising and like capillary vessels to bleed. But what arnica will actually treat in a homeopathic preparation is that very same thing that it would cause. So it treats bruising, it treats muscle soreness, it treats all of these different things. It's kind of a weird concept, but it's arnica, and there's another one called Bellis perennis, and those are really great for specifically healing muscle tissue, for healing fascia. So after childbirth, arnica and Bellis perennis you have to have those.
And those are safe with breastfeeding, so you recommend them to birth. Okay. Because I get asked a lot about fascial healing and how to promote that. So basically what I've taken away from you is lots and lots of water.
Yes.
And these homeopathic remedies. How much of each do you recommend, or is that more of an individual?
It's more of an individual thing, but the nice thing about homeopathics is because they are dilute. So the arnica, I just want to clarify this. When you take it, it's not poisonous. It's been diluted down so many times that by the time you're actually taking it, it's extremely safe to take, and it's safe to take. You can give them to newborn babies. It's safe to take during nursing. It doesn't interact with any medications. So oftentimes, in the store, you can either buy them in a 6C or a 30C preparation. That just tells you how many times it's been diluted. You can take, if you have an acute injury or you're really trying to heal quickly, you can take arnica every hour, every 2 to 3 hours. You can't really take too much of it, because it's not dosed in a similar way to, say an Advil or Tylenol, or and it can help with pain. If you've got, any sort of muscle bruising, pain, soreness, it can really help with that.
Nobody's ever sore after childbirth. That's just a myth.
Well, but I will tell you that arnica also is amazing for, like, so this may be a little TMI, but I used homeopathics during I had 2 home births, and everyone, I'm sure everyone has seen, I don't know if anyone looked at their vagina after birth. Sometimes it can be not a pretty sight. It looks very bruised. Well, I was kind of curious. I'm like, I've been taking all this arnica. I kid you not, 4 hours after delivering my daughter, my vagina looked almost normal. I mean, it was so large, but there was like no swelling. So arnica works very well to help reduce swelling. And so next time you have a baby, make sure to get your
keep it on hand. But that's such great tips. Thank you so much. Okay, one more thing that we talked about on the phone that I thought was really important, and I really appreciated your opinion of it. We talked a little bit about mindset training, how you think about things, and how you defined yourself, particularly in the face of trauma. And when we're dealing with postpartum women, childbirth, I had an easy childbirth, but it was still traumatic. So would you mind just sharing a few more of your thoughts on that?
So I talk to a lot of women about this. It's what happens up here is so important when it comes to healing. So the positive thinking, the thinking, I'm going to get better, I'm going to heal, is, I said breathing was the number one thing. I think we back up a step even further, that what's happening up here is the most important factor when it comes to getting over a trauma. So, dealing with trauma is it's not easy. And you kind of have to let yourself, give yourself a break a little bit, because you are recovering from something, but you also need to know, like, you can get over this, you can get better. You don't have to be stuck in that trauma mindset.
So what advice do you have women to help them make this mindset shift, help them go from victim mode to this is hard, to positive, I can do this, I can work, I can fight for myself? Because I think that's something I want to get people fighting for themselves.
And that's a hard thing. Sometimes it's almost like you've got to flip a switch in the brain that says, okay, I'm no longer the victim. I need to take action. And I think what you're doing, the first step, giving someone an action that they can take control of. Feeling like you have control over something, because a lot of times, childbirth, you feel like you don't have control over your body. You don't have control, if it's not the childbirth that you imagined, you wanted a natural childbirth and you ended up with a C-section, you feel like you've lost control. So starting to exercise, taking care of your diet, doing all of those things, that really helps you feel like you take control of that. But the other really important thing is to make up a mantra. I am healthy, I am well, and fake it till you make it. Get up, read that mantra every morning. If you don't really believe it yet, at some point you will. So, I tell a lot of patients about this. Oh, no, I'm sick. I'm not going to get better. I'm not going to get better. I say, no,
you are what you think yourself.
Yeah, you are going to get better, and you need to think that. And it's the same thing. Like if you have a hard time switching that mindset, you literally need to write out a mantra of what it is you want. I am healthy, I am strong, I am thin, I am whatever the goal is you're trying to get to. I am happy, I am fulfilled. And you say that every day, even when you're having your crappiest day, you just need to read it and you just need to say it, and then you move on.
I'm a big believer in finding something positive in everything. And that just gratitude training has been really great for me, because even when things are just not going well, I can usually find something to be thankful for. And in that moment of thankfulness, it puts me back in a positive place. Like, all right, things are not that bad. I can do this. I'm lucky because of X, Y, and Z. And so you focus on, did you notice how sometimes people tend to only focus on the negative, and then you have those people that only focus on the positive? So switching over, I find gratitude to be such a great way to help switch to the positive.
Oh yeah, the gratitude is such a huge piece. I mean, and they've done research, you know, in particularly in cancer patients, you know, the patients that have that positive outlook are the ones that are going to, you know, get better and you know, become cancer free. More so over the ones that, you know, have a negative outlook. So it's, and some of those patients will tell you that they had doubts, but they just got up every morning, and there, you know, you're always going to doubt yourself, but you get up, you know, and you have your positive mantra and you say, you know, say whatever, I'm healthy, I'm healing, I'm whole, all of the things that you need to say to make, you know, to kind of fake it until you make it.
Yeah. Awesome. Well, Dr. Kinney, thank you so much for taking your time. Is there anything you want to add? Any parting thoughts, or do you? I feel so good about everything we covered, and I feel like everybody's going to walk away with very specific tips from this talk.
No, this has been great. I mean, keep doing the work that you're doing, and to all your women in your group, I mean, that I think that positive outlook thing, which Sarah is clearly helping to give you guys, keep up with that, because that, you know, that is the number one most important thing as you're on your own journey towards healing. You know, keep up with the positive outlook and the deep breathing and all of the, you know, the rest of the stuff will fall into place. You know, you get that good foundation.
Consistency, yes, consistency, yes. Okay, well, thank you so much.